Good evening. My name is Taiwo, and I'm going to be your nurse today. How are you?
I'm fine. How are you?
Good, good. What is your name?
My name is Sam.
Sam. Okay, Sam. How old are you?
I'm 18.
You're 18 years old. Okay. I'm here this evening to perform a head, eyes, ears, nose, mouth, and throat assessment on you. Is that okay?
Yes, that's okay.
All right. Also, I need to get your consent that this assessment will be uploaded on YouTube for teaching purposes. Are you consenting to that?
Yes, you have my consent.
Oh, okay, good. So I have my patient here. His name is Sam, and he's 18 years old. He has given me consent to perform the head, eyes, ears, and nose, throat assessment on him this evening. And before we get started, I have washed my hands. Have done proper hand hygiene, and also I want to perform this assessment. I have some tools here that I'm going to use. I have my otoscope. This one, I'm going to be using this to look into your inner ears, your eardrums. Okay, I have my ophthalmoscope. This one will be to look into your eyes. Okay, and also I have my flashlight. I have my flashlight here that I'm also going to be using to look into your eyes and also part of your mouth and your nostrils. Okay, and I have my snell chart here just to see how your vision is good. I have my tongue blade here just to check for your gag reflex as you go into the examination. Okay, and so we're going to get started. The first part of this examination is to inspect your head. Okay, I want to part of the inspection of the head is to look at the structure of your head, to look at the that if they are symmetrical and if they are normal cephalic, so that your head is in the right shape or proportion with the part of your body. And as I can see here, your head is symmetrical, and I don't see any swelling around part of your head, and it's normal cephalic. And part of the examination of the head is also to palpate, and to palpate I'm going to put on my gloves. Okay, so the purpose of the palpation is to check for any swelling in your scalp, to check for any hematoma, like a swelling, like any abrasion. Okay, so I'm palpating here. I look back, the back of his skull. I don't see any swelling. I don't see any abrasion. I don't see any hematoma. And also, part of the palpation, I want to also check for any investigation like lice in his eyes. So in his ears, the hairs are black and shiny. I don't see any sign of hair loss like alopecia. His ears, they have a normal growth, and they are very thick and shiny. Okay, so having done with that, I also want to look at your face. And part of looking at your face is to see that the two sides of your face, they are symmetrical, that there's no drooling, there is no eyes drooling in your face, like some patients, they will have like Bell palsy. One part is drooping than the other, but your own case is normal, is symmetrical. And while we are here, I'm going to test for cranial nerve 7, which is facial. And I'm going to have you, I'm testing for cranial nerve number 7, which is facial. I'm going to have you, Samuel, make a smile for me. Can you frown? Okay. Can you pop up your cheeks? All right. Good. So all this, the cranial nerve number 7 is intact, and it's able to smile, is able to pop its cheeks, and is able to um, also make facial frowns. Then part of my inspection of his face is to look at the color of his skin. The face, the color of the skin is brown, is shiny. There is no jaundice. There is no skin discoloration. I don't see any pores or any abnormal growths on his skin. They are smooth. This color of his skin is smooth, and so then the next one is to check for cranial nerve number 8, which is no, cranial nerve number 5, trigemina. So to check for trigemina, what I'm trying to do here, Sam, is to check for how you move your cheek muscles. Okay, so I'm gonna have you make a clinch, like when you eat, how you bite on your food, that your muscles, they are the nerves that control your muscles, they are working good. I'm gonna have you make a clench of your teeth tight. Okay, and also while I'm here, I'm palpating the trigeminal nerve here, and it's pounding, it's palpable, and also I'm going to have you open your mouth against resistance here. Okay, good. All right. Okay, so after we have finished, examine your face, and we've checked for cranial nerve number 5, which is trigeminal, and so the next thing to examine is your eyes. Okay, and when we come to your eyes, what I'm going to do first is to inspect. So I want to look at your eyes. I want to make sure that your eyes is not bulging. I want to make sure that your pupil normal are the same. You don't have one small or one big one. Then also there is no drooling of or drooping of one side to the other, and also there is no nystagmus, which is involuntary movement of your pupil. So, and also part of my examination, I'm going to put on my glove, is to check your lower eyelids, okay, and your upper eyelids. Check your conjunctiva. Make sure that there's no yellowish discoloration. Okay, so when I look into his eyelids, so the conjunctiva is moist and pinkish, which is normal. Okay, is pupil, the pupil is white and shiny, and the upper eyelids is also pinkish. So on the other side also is pinkish moist and pupil white shiny. There is no yellowish discoloration that can indicate any jaundice at all, and there is no swelling. There is no redness at all. So it's a normal finding. So then to move forward, I'm going to check for cranial nerve number 3, which is oculomotor, okay, to see how the conduction of your eyes to light. Okay, so what I'm going to do here is have you just follow the gaze of this light I have in front of you. So do it 6 cardinal points, and so its pupil reacts appropriately and follow the light. So I'm going to turn off the lights for a second to see how your pupil reacts to light. Okay, I'm gonna have you look straight, have your pupil wide and dilated for me. Okay, look straight. All right. Okay. That is a consensual reaction when I flash my lightest left pupil. The left pupil comes straight, and also the right pupil comes straight. When I do also on the other side, the right pupil comes straight, and also at the same time the left pupil comes straight. That is good. That's good. So then the next test we're going to do while we are sealing your eyes is to check for to do the Snellen chart, or to check for your vision, to see how what vision do you have. Okay, I'm going to step back like 6 feet away from you and have you read this. Close your right eye and use your left eye to read. What do you see?
LTFPH.
Good. Okay. Do the other side. Left eye closed, tight. All right. What do you see?
LTFPH.
All right. Good. All right. So my patient vision is 20/20 on both eyes. On both eyes, his vision is 20/20. Okay, so having checked for cranial nerve number 3, cranial nerve number 6 absence. So the next thing we're gonna check for is to go now into your ears. Okay, so we're gonna go into your ears, and first thing I'm gonna do is to inspect. Okay, I want to look at your outer part of your ear, which is called pinna. See that there is no abrasion, there is no swelling. The outer part is fairly gray, and there is no redness at all that can, and there is no accumulation of any tophi, because a patient with gout, they can have accumulation of tophi or uric acid around their ear. So I don't see that here. So then we do I'm testing for cranial nerve number 8 here, vestibular, cranial nerve number 8 vestibular. And so that also tells us, you use your ear for balancing, make, with the hearing, you help you in balancing, to maintain balance. So I'm going to do a couple of tests for you before I look into your inner part of your ear. Okay, so the first one we'll do is, let me use my otoscope here. And are you okay, Sam?
Yes, I'm okay.
Any pain?
No pain.
Okay. Okay, so part of this one is also to palpate and to see if there's any pain. Do you have any pain here?
No pain.
Any pain here?
No pain.
Okay, so I'm going to use my otoscope go into the inner part of your ear. And I'm on the left ear, so I will come straight. So usually, like you and adults, the way to examine your ear is to pull your outer ear up and back, okay, because you're an adult. Then what I'm looking for, I'm checking for any redness in the inner part of your ear. So check for any exudates, any pores, any drainage, any bulging. I don't see any bulging, I don't see any redness. So the extraction tube is pinkish and moist. There is no wax, and also I don't see any swelling. Okay, then I'm looking also for the light cone. The light cone on his left ear is at 7 o'clock. The cone of light on his left ear is at 7 o'clock, which is normal. All right, good job, Sam. So you keep your ear clean. So we're going to do the same test on the other side. Okay, so having inspected the right ear and there is no redness at all, so we're going to check for any bulging. So like I said, for an adult, I pull his pinna or the outer ear up and back. So to have it secured, okay, there is no redness, there is no swelling, there is no bulging. The extraction tube is pink and moist. Then the cone of light on his right ear is at 5 o'clock. The cone of light is at 5 o'clock, which is normal. Is normal. Okay, good. All right. So part of to check, in addition to that, cranial nerve number 8, vestibular, is to do a whisper test for you. Okay, a whisper test. I might have you close your right ear, and I'm going to whisper to your left ear and tell me what you hear. Okay.
Blueberry.
What did I say?
Blueberry.
Okay, good. All right. So I'm going to have you close your left ear, and I'm going to whisper to your right ear again. Go to school.
Go to school.
Go to school.
Go to school.
All right. So my patient cranial nerve number 8 is intact. There's no hearing loss. Then before we move forward, we will do air conduction test. Okay. And so this one is we'll use this to check for air conduction and bone conduction, and which is Rene test, and also we'll do Weber test. Okay. All right. You with me?
Yeah, I'm with you.
All right. Good. If you have any question as I go with you, you can stop me and ask. Okay. All right. So with the air conduction, I'm going to just get a tone and tell me if you hear it on both ears. Okay. Do you hear it on both ears or just one ear?
One ear. Or both. Both ears.
Okay, we'll do it again. Which ear do you hear it?
Both ears.
Both ears.
Yes.
Okay, good. All right. So that is the Weber test. Okay. So he heard the sound on both ears. So then let's do the relay test. So this one to the master bone right here. Tell me when you don't hear it anymore.
I don't hear it anymore.
Okay, now do you still hear it?
Yes, I still hear it.
Okay, good. So that is, you can still hear it. The air conduction is greater than the bone conduction. Okay, so you don't hear it anymore because the bone conduction is lesser. But when I bring it to your outer part of your ear, which is the air conduction, you are able to hear it. So that is a sign that your hearing is normal, it's intact. There is no consensual hearing loss at all. Okay, so we are done with hearing, and the next thing to examine is your nostrils. Okay, part of the examination of the nostril is to inspect, your nose bridge, make sure there is no swelling, and also to palpate your maxillary and tell me if there's any pain. Any pain?
No pain.
Then frontal nodules. Any pain?
No pain.
All right, good. All right, so I'm going to have you to check that your nostrils are patent. I'm going to have you close one nostril and blow through the other one. Blow. Okay, good. Then do the other one. Blow. Okay, good. So next thing I'm doing here is to look into his nose turbinates and check the nasal passage. Ensure that so with this one I'm going to use my flashlight. So you look up for me. Okay. All right. The nasal turbinates is pinkish. It's not reddish. It's not. There's no bulging. There's no exudate. There's no any mucus plug on the left side. Then also on the right side, it's pinkish. It's patent. And there's no excessive hair growth. Okay, good. All right, so but to check cranial nerve number 1, olfactory. So olfactory nerve is to ensure that you can smell. Okay, so olfactory nerve is to check that you can smell. Where's my... So you're going to close your eyes tight and you tell me what you smell. What do you smell?
Vanilla.
Vanilla. Okay, so this thing is made with vanilla. Okay. On the other side, what do you smell?
Vanilla.
Okay, good, good. So it's olfactory nerve, cranial nerve number 1 is also intact. So then we will go to check your mouth. But then with mouth, we're going to start from your lips. I want to ensure that your lips are, by inspecting your lips, ensure that they are pink. There's no swelling. There is no cracking of the lips. So I don't see any cracking that can indicate either malnutrition or dehydration. Okay, then they are also looking, I will have you open your mouth. Okay, so as I check for cranial nerve number 11, as I check for cranial number 12, okay, hypoglossal nerve. So I want to check your tongue. So stick out your tongue for me. Okay. All right. So his tongue is pinkish. There's no redness of the tongue. There's no dryness. A patient that have a pernicious anemia, their tongue will be reddish Yeah, and patients that have dehydration, their tongue will be dry. But in his own case, his tongue is pinkish and moist. Okay, then I'm gonna look to the inner part of your mouth. Um, so the lower part of the tongue is also pinkish. It's moist. There's good dental hygiene. I don't see any dental caries, and okay. Then I'm gonna have you open your mouth wide. I'm looking at the hard palate and the soft palate. They are pinkish, they are red, and the uvula is at the midline. It's not bulging, okay? It's not bulging, and it's at the midline. All right, good dental hygiene right there. So, um, we will check again cranial nerve number that's number 9. Then we check again cranial nerve number 11. 11 accessory nerves. I'm going to check and ensure. No, I'm checking for cranial nerve number 9, glossopharyngeal. So see how you have a gag reflex. Okay, how you have a gag reflex. All right. Okay, let's do one more time. Okay. Okay, so gag reflex is intact. All right, good. So, um, is cranial nerve number 10 vagus is also intact because he's able to talk to me without any hoarseness, without any cracking of his voice. Okay, so and then we will. The next thing is to um, check for your neck, and when I'm checking your neck, I want to palpate all the nodules from the anterior. From the. I want to palpate the nodules, um, the lymph nodes, mandibular, submandibular, posterior, or cervical, and usually lymph node is about pea size, but where the swollen will be more bulging. I don't see any bulging of lymph nodes, and they look good. So then we'll check for your swallowing. Okay, so I'm going to have you swallow. All right, good. Swallow one more time. All right, good. So that's cranial nerve number 11 accessory nerve. So it's able to swallow good with no problem. Okay, so the next thing is to palpate is carotid arteries. So we're going to palpate your carotid artery. So carotid artery is right here by the trachea, and we palpate it bilaterally. So it's full pounding and 2+, and then also on this side it's full and pounding. All right. So, and then I'm going to use my stethoscope, the bell of my stethoscope, to auscultate your carotid arteries. What I'm looking for bruits, okay, which is abnormal. Okay, I don't hear any bruit, so your carotid arteries. Uh, so everything looks intact, and you've had a very wonderful time. The examination we conducted today is normal. I did not see any abnormal finding at all. So, and also, I want to appreciate you for the time that you allowed to do this video with me, and I hope to see you another time.
Thank you, Dr. Taiwo.
Thank you. Oh, I'm your nurse, okay?
Nurse Taiwo.
All right, good.